Welcome to the Faith and Mental Health Podcast, where two worlds collide. I am your host, DeAndrea Bolden. Join myself and others as we have relevant, engaging conversation on a variety of topics that are related to faith and mental health. So be sure to tune in weekly and also to subscribe. Did you know that you can listen to this podcast on all major podcast platforms, such as Apple, Google, and even Stitcher? You can even catch this podcast on my YouTube channel. As a listener, please know that we want to hear from you, and we hope that you would reach out with feedback, suggestions, and even ideas for guests and topics that you would like for us to include. Oh, do you mind helping me out by simply sharing this podcast with others? Thank you, and I hope you enjoy today's episode. God bless. My name is DeAndrea Bolden, and you are listening to the Faith and Mental Health Podcast. Today, I have a dynamic guest with me. I'm so excited to have her. Her name is actually Gloria Cisse, and she's going to talk to you about all things mental health. She is an SME. That means a subject matter expert. She has a ton of experience. Well, let me stop there. I'm going to let her tell you about her. She can tell you more about her than I ever could. And so, Gloria, can you please introduce yourself to our listeners?
Good morning, everyone. I am Dr. Gloria Cisse. I actually this year last year earned my doctorate in social work.
Awesome.
I'm the CEO and lead therapist at the Southern Center for Choice Theory. I have been practicing for over 20 years with adults who have committed sexual offenses, family violence, as well as victims of abuse. I'm certified in choice theory and reality therapy. I'm also a certified clinical trauma professional. I have loads of certifications. Sometimes I become overwhelmed by all the certifications that I've earned. But I am also a trainer, and I have written a few books on how we can be more successful in managing our mental health.
Okay, you just said a lot. First of all, I have to take a step back. I apologize. I did not know that it's Dr. Cisse. I'll make sure that's updated everywhere. You know, earning a doctorate is something that is should be acknowledged, and that is a fantastic accomplishment.
Thank you.
Number two, you do a massive amount of things with your practice, and I want to get to the books at the end. We'll get to the books at the end because I do want to acknowledge those. But first, I want to talk a little bit more about what you do. Can you talk about some of your experience working with people that have dealt with childhood trauma, that may have been diagnosed with PTSD, and those that may also be dealing with complex trauma?
All right. So I started working with children who experienced or been exposed to trauma probably in about 2004. And I remember 2003, 2004, and I remember the first child that I met who I knew had been traumatized significantly. I was sitting with her. I was novice, right? I was a novice, really.
Mm-hmm.
And I was sitting with her, and we were playing, right? Just playing with a few toys. I asked her a question. I do not recall the question. And instantly, she vacated the therapy room. Now, she didn't physically leave the therapy room. She actually dissociated, which meant that she was experiencing, a form of PTSD or a symptom of PTSD. And I did not know what to do. She was seven and had experienced so many horrific things in her very young life that, I was really struck by my lack of ability to help her. And so I started kind of searching for things that I could do to just kind of ameliorate some of the symptoms that she was experiencing. I started learning a lot about trauma and the impact of trauma on the brain and the body. And I've
Yeah,
taken it further to learn about the impact of trauma, historical trauma, or generational trauma
that's good.
on the body, and then how we can prevent those, because I have also over the years worked with adults who have who experience childhood traumas, but they are in their adulthood and the trauma has never been addressed. So they bring all these
Right.
behaviors to their adulthood, including those people. Some of the people who have committed sexual offenses were traumatized. Some of the people who commit family violence offenses have been were traumatized in childhood, but the work was never done, particularly in the African American community. The work has not been done. And so we find people, it has been my experience over the last 20 years that people come with all of this stuff. They come to adulthood with all this stuff
Mhm.
that was unmanaged. And so I kind of switch courses and start working on what can we do to not only help people who present with these, and we do tertiary prevention, but how can we start to teach people how to sustain, enhance, and support their mental health, and be more intentional about how they manage their mental health. So I started diving into infant mental health and perinatal mental health, and how we can do things to prevent, or at least to minimize the symptoms, or make people more resilient, right? And so they don't bring all those things into their adulthood.
That's
So
good.
that's primary, secondary, and tertiary prevention. We really have to really work on primary, secondary, and tertiary. We can't just work on one aspect of our mental health
Right.
or what's happening in our society. We have to work on the whole situation, the whole body of trauma.
Yeah, that's good. That's really, really good. And I like how you mentioned that, even sometimes that people that are offenders
Mhm.
have been, victimized, or people that have suffered a lot of trauma. Trauma has definitely been a buzzword, but I love to hear when you're talking about it from a place of experience, a place of having the academia and the training behind it, because it has become kind of a buzzword. Every time I look up, there's an event, overcoming your trauma, or this, and
Mhm.
I'm like, this stuff is too complex to
Mhm.
try to minimize it to a little Saturday workshop and stuff like that.
Mhm.
And I also warn people that you have to be careful when you're dealing with people that have dealt with extreme trauma. You can open someone up and cause someone to break down if you don't know how to handle them and close them back down from a
Exactly.
clinical place. Because
Yeah.
just like you said with the 7-year-old, when she started dissociating, you didn't know what to do. And so I think people have to be careful trying to dive into the world of trauma thinking that it's just a buzzword, because some people you can trigger somebody really badly, and really disturb someone's mental health if you don't know what you're doing. And so I just applaud you for your work. You said a lot when you talked about prevention. One thing that stuck out to me that you said was perinatal mental health.
Mhm.
And I have a speaker. She's going to be live with us in Kalamazoo, Michigan. Her name is CG Gamble, and that is her entire practice, and that
Mhm.
is her entire expertise is perinatal mental health. And so, yeah, that's a huge thing. I won't even go down that rabbit hole, because that is a topic that I wish I knew more about when I was, pregnant, and even after I had my children and stuff like that, not really understanding and recognizing those things. But can you talk a little bit more about the work you do with people that have been abused? I
Okay.
know you mentioned something earlier on that you work with people that have been abused. Can you just talk about some of the, I guess maybe some of the success stories? Because somebody may hear this and say, you know what? Um, I've gone through certain things, and maybe because sometimes people don't sometimes people have the mindset of, it'll work for others, but it won't work for me. I even find that people will refer people to go to therapy and won't go themselves.
Exactly.
So I just want you to talk about maybe I won't say the success, but the benefits that
Okay.
someone can achieve
Mhm.
if they would allow themselves to go to therapy after experiencing, a lot of trauma and a lot of, abuse and different things like that.
So the first thing I want to say is oftentimes people don't come to therapy unless somebody like suggests or strongly mandates that they come to therapy, which is something we really want to change. We believe
Right.
that everybody needs a therapist. But I also want to talk about, a lot of times people who have been traumatized, the way the brain and body works is that the trauma is stored in the body, in the limbic system, nervous system. And so they will be triggered by any number of things because all of our sensory system is involved, right? And I think this is critical to your question. I hope it is. Because so people can be walking around wounded. Sorry. Walking around wounded.
Mm-hmm.
And there could be a smell that they experience that triggers them,
Yeah.
and we don't know, or sight or a touch, so it's and not just somebody saying something to an individual or trying to approach trauma without having a significant a well-trained background in how to help people manage their traumas. But when we see people who show up, especially children who have been traumatized, or you see a child and they come and they're angry, or they are hyper vigilant, meaning they move around a lot, or
Mm-hmm.
they are then we want to have them diagnosed, or we want to say they're bad, or we want to say this adult is violent or whatever, when they may be struggling with trauma. Now, to your question about success, I have had so many people who come through my program who have, because we teach this thing, we work with people where in a way where we establish plans and we identify um, specific goals, right?
Mm-hmm.
So, and we use a lot of different kinds of techniques. And so I have had people come to me and they are crying, right? I mean, just literally bawling and bawling for a couple of meetings. We don't call our meetings sessions, we call them sojourns.
Okay.
And so they might come for several sojourns and they have very limited control over their emotionality. But by the end, I had this one woman who told me, she said, you know what I feel like, because we don't keep people in therapy forever,
Right.
because that's not beneficial. So we have specific plans and we help people move towards those plans and then they move on.
That's good.
So she was great, moving down. So we were stepping her down in therapy. She'd been in therapy because she had complex traumas. And when I stepped her down the second time, she said, "You know what how I see you? I see you as the person who's holding my bike, and I'm learning to ride a bike. And every once in a while, you let it go, and so I can practice, use my own skills, increase my own sense of agency. And then when I'm struggling, you reach and you grab the back of my bike, but I know eventually you're not going to hold the bike anymore. It's going to be up to me." And that made, and she was telling me how it made her feel so empowered, because she knew that as long as she needed me to just kind of hold on to the back of the bike, I was going to do it. And so for me, the idea of, and gosh, I could go on because I'm thinking about someone I met who was actually experiencing some psychosis, and how, after a few months of working with her, she was able to uh, um, see things and maintain her life without having to go back on medication, or people who come to me and have a slew of diagnoses, and had things turn around in their world. which is one of the things we do that's not, we give people a lot of diagnoses and it's not always helpful. So, but I'm going to leave that alone for now. But this woman had, because of trauma she experienced in her childhood and people trying to figure out how to change her behavior, she had multiple diagnoses, including, what would be termed as bipolar disorder with psychotic features.
Okay.
And about to lose her access to her children, her family. And I remember the first time I sat with her and I said, okay, so do you want to continue to be like this? Or do you want to try to change some of the things that are going on in your life? Because I really believe that we have more control over our mental health than we've ever been told. And she said, you think I want to be like this? And I said, well, I'm just asking a question because I can only do with you what it is that you want me to do with you. And so tell me what it is that you would like. And she said, I want to get my kids back. And I said, well, this is a plan we're going to work on. People perceive you in a certain way. If you want them to see you, and crazy is not in the DSM, but this is the word I use.
Right.
You want them to see you as crazy, keep acting the way you're acting, and they're going to take your kids. Or we can come up with a plan so that you can change your behavior, because that's how people are labeling you based on your behavior. She wasn't crazy. She wasn't crazy. It was her behaviors, and her behaviors were all associated with the traumas that she had experienced. And then the ineffective ability of the people who were working with her previously to identify, because of all this other stuff that was clouding up the environment, right? Her responses to them, the previous diagnoses, all these things were clouding up their views and their perceptions of her. It was really the trauma. So we worked on the trauma, and we worked on helping her to modify her presentation to the world. And when one thing went down, the other went up. She got her kids back. So
Okay.
but it's hard work, right?
Yeah.
She was willing to do the work. All of those people that I have mentioned to you were willing to do the work and not just kind of ruminate over the same situation over and
Right.
over and not move forward.
That is really, really good. There's so much I can say because I'm just gonna leave it alone. I definitely because one thing you said that stuck out, and I was like, I need to quote it and put Dr. Cisse on there, because I have had to tell people, I said, therapy is not a checklist of something you just do. You should be getting better. And if you're not, you need to find another therapist.
That's right.
I said, listen, when you go, you're supposed to have certain goals and certain things that you want to see progress in your life.
That's
And
right.
if you're not seeing any progress, saying you like your therapist is great, but if they can't help you reach your goals and get your mental health in order, it's not worth it. You gotta find somebody different.
That's right. Two things people believe. One, which is kind of it's one of the problems in our profession, is that people believe they go to therapy and there may not ever be any change. But if they just go and they have somebody to talk to, that really feels good to have somebody just listening to you, right?
Right.
And sometimes they don't believe that they can ask or they can say that I need to change therapist.
Right.
So for us, what we are really working to help people do is take back their sense of agency, right? So you can't do that if you don't have information. And so you can, if you start looking for a therapist and have a therapist saved in your phone before you get into a crisis, then you don't make the mistake of connecting with somebody who isn't really going to help you. You have already started to build a relationship. The other piece is, so I practice using choice theory, and I practice using choice theory because it fits my personality, and it helps me to believe that I can help people move in a specific direction. But my personality is to be very direct. And I will say to people, this is how I do therapy, right? And for me, I feel like I haven't done my job, what you pay me for, if there's no progress. And then if there's no progress over, after a certain amount of time, then my perception and what we're going to have the conversation about is whether I'm the right therapist for you. And sometimes that's a big problem for us when our sense of self is tied up in what we do. Right. So we won't say, I don't think I'm a good fit for you, right? But I tell people, I'm gonna, if it doesn't look like, and I'm not saying this to pressure you to pretend that something is changing in your life. I'm saying it because I'm giving you back the control over your therapy, because that's ultimately who the therapy is about. And then there's also this issue of, and I probably say it to Rank, I say it all the time, but this issue of practical mental health, which we don't always practice. Mm-hmm. And so for me, this whole thing means creating an environment conducive to change, and an environment where people are making progress, as opposed to kind of stagnating, staying at the same place. I sit with people and I hear their stories, but first and foremost, I try to help people understand that there is hope. If you're willing to do the work, we can help you get there.
That's good. That's good. I wanted to quickly go back and touch back on two things. Mm-hmm. One, I just talked about, what was it? The other day, I did a podcast interview, and then the other one, I just wanted to define. I know I always tell people I like to assume that people don't know. And mm-hmm. So when Dr. Cisse was referring to psychosis is considered like a break from reality. Mm-hmm. A person may be dealing with hallucinations, mm-hmm. Which is seeing or hearing, sometime either tasting or feeling things that are not there. Mm-hmm, mm-hmm. They could even be dealing with word salad, saying things that don't make sense, repetitive movements such as pacing or rocking, repeating the same words over and over. They may show a lack of emotions or a lot of negative emotions. Mm-hmm. They could have a lot of mental confusion, a lack of orientation as far as like where they are, who they are, that type of thing. Psychosis is very broad, I kind of want to say, and that's why she said bipolar disorder with psychotic features, and I believe that's how it's laid out in the DSM-5, and that just means that somebody may be bipolar, which is classified by the depression and the mania, mm-hmm. manic episodes. But they may also have hallucinations and things like that, which people typically associate more with schizophrenia. Mm-hmm. So I just wanted to take a moment to kind of explain that just a little bit, but there's a whole lot of information, clinical information that can explain that better. But I also wanted to touch on another thing when you talked about the woman with the children. Mm-hmm. I cannot tell you how many African-American women have reached out to me afraid to go to therapy because they don't want to lose their kids.
Oh my gosh.
Like I had to come back to that.
I believe it. I believe it happens. But most of the time, the people that I see who come to therapy and they're at risk of losing their children, they're mandated to therapy. And so around here, there are not a lot of people who are just reaching out, because for me, if you come and there's something going on, right? Then as long as I don't hear, because all of us are mandated reporters, as long as I don't hear where you are physically, you're causing harm to your child or psychologically causing harm to your child, then there is no need to make a report. But the other piece is that we talk to people about that up front, and in informed consent, we talk to people about those things. But it is so possible. It really is possible to help people before. I mean, I've created a parenting class. We do parenting for anybody, because I believe we don't, we learn how to parent from our parents who brought their histories of traumas into their parenting, right?
Right.
And are transferring that information unaware, that they're teaching us how to respond to situations the way they learned to respond to it, which is sometimes heavily laden in traumatic experiences. And so I'm in my late 60s, mid-late 60s. Well, actually, I'm 67. I'll be 67 soon. And I have 5 adult children, 27 grandchildren, and 6 great-grandchildren.
Wow.
And what I know is through all my experiences, I made a lot of mistakes.
Okay.
My kids make mistakes. So it's like I sit and I think, if I could have known better, I would have done better. But I can't go back and change that. So what I can do now is teach moms who need, and dads and grandparents who are raising grandchildren, all this wealth of information and knowledge that I have acquired. And so when we have the information, then we reduce the likelihood that we will harm our children going forward. I want to add. I mentioned mental health, and you did a definition, and so I really want us also to start, because there's a misconception about mental health, right? So the word mental health, the term mental health, has gotten tangled up with mental illness.
Very true.
And I in my practice, I really want people in my work, I want people to become more focused on mental health versus mental illness. And so that's where the intentionality and the proactivity comes in, right? We can be more mentally healthy. So the definition of mental health, according to the World Health Organization, is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stressors of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So that's not mental illness, but the World Health Organization says that a lack of mental illness or mental illness diagnoses does not in and of itself imply mental health. So what we have to focus on is becoming more intentional, more proactive about mental health. And I know my minutes are almost up.
Oh, no, you're fine. We'll wrap it up. We got it.
Okay. So I think it's really important that we all, start identifying a mental health professional who is focused on mental health, which, I'm saying my practice, that's what we do. We are focused on mental health. And I'm trying really hard to garner the support of more mental health practitioners, so that we can start to help people be mentally healthy the same way we try to help people to be physically healthy.
Yes.
That mental health is equally important as physical health, and that we start before birth, right? Not just in the perinatal phase, but when kids are in elementary school and in high school, teaching them how to be more mentally healthy, right? That they have the capacity to be more mentally healthy, first and foremost. And again, I'm going back to Taranga. I'm talking about Taranga. And so we're teaching people to be more mentally healthy. We're teaching our agencies and organizations that we need to start focusing on helping people to be more mentally healthy, and maybe possibly reducing the likelihood that people will develop all of these mental illnesses that we see in our society right now. Bruce Perry said there is a big gap between what we know and what we do.
Yes.
And so I'm long-winded.
No, you're fine.
Okay. So
I was just laughing because I like that quote, because there is a big gap between what we know and what we do. That's why I laugh.
Yeah, there really is. And so we know that attachment is very important. We know that rocking babies is very important to the development of their vestibular sense. We know all these things about parenting and the human brain. He also said that Bruce Perry also said that the human brain developed over centuries, thousands of years in hunter-gatherer groups. So that means that this idea that we got to raise our kids by ourselves is not healthy for the development of the human brain.
Right.
Kids need to be exposed to multi-generational, levels of achievement, individuals with, different kinds of skills and so on and so forth, so that their brains can develop more healthy in a healthier way. So, and Selma Freyberg coined the phrase infant mental health, but she talked about the ghosts in the nursery. Joy DeGruy talked about post-traumatic slave syndrome. And what we know is that the transgenerational trauma that we have embedded in our bodies, we're transferring to our children. And so we just got to get to a place where we say, yep, I know it's there. Let me do something about it, so that I can maybe interrupt what's happening for the next generation. I can't go back and raise my children, but I am constantly talking to my children and grandchildren about how they can use the information that I'm giving them to better raise their children. And I'm offering any mom who wants grandparent who wants to sign up for my parenting class. We talk about all these things that we're offering people this information so that hopefully we can interrupt what it might happen, what we have brought to, what I brought, because I'm taking responsibility for me.
Right.
What I brought to this point in time, I'm trying my hardest to disrupt what may happen in the future.
That's good. That's good. I want to thank you for taking the time to separate the concept of mental health and mental illness / mental health disorders. People tend to use those words interchangeably because they just simply don't know the difference. And so thank you for taking the time to define that. I'm big on definitions and trying to break things down so people can understand, because I just try not to assume. I don't assume that people know.
That's right.
So I thank you for doing that. That's something that I have done definitely in the past and will continue to do, because I would just hear, people will make little statements and I'm like, okay, I get your heart, but let's understand this a little better. Let's get some understanding. And so quickly, I want you to, we got a couple minutes left. I want you to share any upcoming events you have. I want you to tell people about your books and where they can get them. And I also want you to tell people how they can connect with you and contact you. Whether it's via social media, email, phone, whatever. So dump all that information out on us this last few minutes before we get off of here.
Okay. All right. So I have oh my gosh, that's always self-promotion is always challenging for me. But I do have an upcoming training where I am offering, I'm a trainer for the Glasser Institute faculty member. So I am offering an introduction, actually an intensive week in choice theory and reality therapy. It will be face-to-face here in Macon at the Booker T. Washington Center, but there will also be a virtual option. I have written several books. They can be found on my secctgeorgia.com website under shop or something like that, I think. But the one I'm really proud of recently is a children's book that I wrote, and it's called Belly Full of Butterflies. And the purpose of that book is to help children learn how to identify uncomfortable touches. I think I mentioned that I had worked with adult sex offenders for about 20 years and also children who've been sexually abused for about 20 years and adult survivors. And one of the things that I learned is that nobody's telling kids how to say something when there's an uncomfortable touch, because offenders have a way of getting kids used to them touching them. And so I'm on Instagram as Gloria Cisse. My business is the Southern Center for Choice Theory. We are here located, our primary office is here in Macon, Georgia. And we can be reached by telephone at 478-741-1269, 478-741-1269. I don't dial the number often. I have a hard time remembering it. And we have multiple therapists on our team. and we are trauma specialists. That's it.
Good. That's really, really, really good. And so, Dr. Cisse, I want to thank you for being my guest today. This has been very, very, very informative. I would admonish you that if you were on here, definitely connect with her, get a hold of those trainings, get a hold of those books. This is very, very informative. I can't overemphasize that. And so I want to thank you guys for listening in. Thank you to all my listeners and supporters. And so, you know how it goes. Until next Wednesday. All right. Bye-bye.
Bye. All right.